Hello, this is an informational video regarding family therapy. The aim of this video that at the end of it you would have a better awareness or understanding of what family therapy is, how does family therapy work, who does it work with, and if it could be useful for you. My name is Lana Galkovskaya, and I'm systemic psychotherapist working in Ireland. At least in the context of Ireland, terms family therapy and systemic psychotherapy are used interchangeably. So it basically means the same. Who does family therapy work with? Family therapists work across all the population. So quite often in my practice I would work with people on their own. Obviously I would work with the families in whatever constellation family comes in. So it could be couples, it could be parents and children, it could be siblings, brothers and sisters, it could be sometimes friends. As a family therapist we also work within organizations. But it's such a big team that I'm just not going to talk about that here, just naming it. How does family therapy work? Family therapy is a way of looking at things. It's a relational way of looking at things. So say when you work with a couple, Mary and John, nearly straight away you realize that Mary and John just not come two of them. What comes into the rooms, it's the families of Mary and John too. It's their experiences of growing up, their value system. How do they see the world? How they understand the world? How did families used to argue? How did families used to make up? How did families used to feel closeness? For families staying together, or they were cutting off and disconnecting quite easily. For instance, I can ask, look, can you tell me how did your parents argue? How did you do arguments? And you can realize that they did it in very different ways. And that's the patterns we still bring in our family. And that's what we are playing out. And maybe it's not working for us that much because we are possibly having the same fight over the last 2, 3, 4, 5, 6, 7 years, and it seems to be so repetitive, and we're never really solving anything. So, and that's where I'm asking, what are we trying to achieve? And trying to figure out, is it even the same aim we are looking forward to? How would you know that after coming here for a couple of months we are making a progress? Family therapy usually is not extremely long way of working. Of course there's a context given, but normally it would be a few months, maybe more intensively, like for a first month, like every week, and then every second week, and every like third week or once a month. Quite often at the end of therapy I would say to people, look, it's an open door policy. If you feel you need to come back, come back. We could iron some things out. So, and maybe it's a wise idea to have your own family therapist. Like, we quite often go to the same dentist or to the same hairdresser, or I don't know, we buy our food in the same shop. So what's the difference? And like, if coming back to the way we're working as well, how would you know what it was useful and what were in the indicators? People could name rather different things. And what is very interesting as well, when we are talking quite often about fights or about arguments or disagreements about some most likely trivial things, it's nearly like who empties and how is dishwasher emptied, to like what time children go to sleep at. When we open things up, say, oh, if you were not fighting about the dishwasher or children, would it be peace, or would we be fighting about something else? People say, oh, well, maybe we would find something to fight about, and then we open up things a bit more. And possibly that disagreement or fight becomes about power, whose voice is most important, or about finance, or about sex life. So those all unspoken things which are not really brought up, but which play a major part. And then as a way of looking at things, we look at what pressures do we have? What demands do we have on ourselves as a family or as an individual? Do we have a mortgage? Do we have children and we need to look after them? Or do we not have children and we are trying to conceive? Or do we want children at all? Do we have parents? How do we communicate with our parents? How are our jobs going on? How is our friendships going on? How is our health? And it all really, really matters. And also given the context that we live in certain country, in certain climate, in certain political situation, in certain religious or spiritual situation, how do we perceive the world? It all really matters. And then while working, small changes start to occur. And that's a really beautiful space when people saying, okay, I want my children in 20 years' time to remember our family as a happy, safe space. So then what changes we can introduce? How can we look at things differently? How can we behave towards each other differently? What are our boundaries towards each other? How do we talk to each other? Is there much respect? Do we shout at each other, or are we not? Do we say to each other how we feel towards one another? Do we even spend time together? And when we talk together, is it all about practical things? Do we have space to talk about us? So we open up all these themes and we address it. And fast enough, actually, in a systemic way of working, you see how things may change. And usually it has prolonged effect, so people incorporate it into their lives. So as I usually would give some small tasks for homework, sort of a say, but it's also important. And then you see how all the family life becomes a bit more peaceful, a bit more happy, a bit more light. So, and the aim of the family therapy, that we all have a future, but we hope that we would have a, better, healthier future. And that's the main aim, I suppose. How are we together? How we stay together? Or if they cannot stay together, how can we be apart and be well? And it's not a holy war going on all the time, but we are more at peace with one another. So hopefully I'm gonna complete this video now. You have a little bit better understanding what is a family therapy, how it works, who it works with, and maybe you find it useful for yourself. Obviously, you're very welcome to leave a comments for this video. Maybe if you have some questions and would be interested to know about something within family therapy, please write. I will be very happy to answer. Maybe I have colleagues who can answer if I know that somebody is more knowledgeable in the area and there's such a wealth of expertise out there. Look, thank you again for watching this video, and I hope you have a nice morning, day or evening, whatever time it is now where you're at, and bye.